Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cooper.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Cooper. I am your host, and today's guest is Zack Cooper, a dedicated nurse and healthcare innovator who has worked in diverse clinical settings, including internationally in the UAE. He's now the executive director of a for-profit addiction treatment organization based in South Carolina, where he leads with compassion, innovation, and a deep understanding of the challenges facing patients and providers alike. Welcome to the big show, Zack.
Hey, Ray, thanks so much for having me. It's great to be a nurse and also get a platform to share that nurses just aren't, bedside hospital fixtures.
Well, let me just start by saying thank you for your service. I think nursing is one of the most underrated, least appreciated professions out there. As a nurse, you really are, in my opinion, the backbone of our medical system. And your work is really to be admired and revered. It's not easy work. And I'd love to gain some insight as to how you chose that as a path, because I don't know what the statistics are, but I'm pretty sure as a male, you're in the minority, right? When I think of nurses, I think primarily of women in that role. And there are obviously men in that role. You're one of them. But how did you decide this as a career path?
Well, I was in college between 2008 and 2012. The economy was not the greatest in the world. And fortunately, I was at college on a full scholarship. And I sat with my dad one day. I really wanted to be a doctor or work. I don't know. I wanted to work in science. I love science, doctor, scientist, engineer, something like that. And with all those things, usually comes grad school. Um, so I sat with my dad and he's like, look, you got 4 years, so make it count. Started doing a lot of research, and the university had a pretty robust nursing program. And I was like, well, I'll apply to nursing. It's a 4-year degree. I can get out. I can make a decent living. And then nursing affords so many different avenues of, career paths for those who have experience. There's now a big push for legal nurse consultants that work with lawyers to help go through medical information and translate it. There's flight nurses. There's nursing anesthetists. There's nurse practitioners in both primary care, acute care, and psychiatric settings. Um, Nursing consultants, and lots of nurses in business now. So that's how I got into nursing. It was basically just a safe play, a safe bet while I was at college for free.
Okay. And you're talking about your undergrad or?
Yes, so that was my undergraduate degree. I was just speaking with a lot of the grad assistants while I was in college. It was I kind of got scared to do anything more. They were, oh yeah, I haven't been accepted into any school, so I'm working for the university, and I think I make like $7 an hour as a grad assistant. Like, yeah, that doesn't sound like
Very,
any
very,
fun at all.
very appealing.
So that's how I got into nursing, and it really has allowed me to do a lot of things that someone from where I grew up would not really have the opportunity to do. My Between my junior and senior years in my undergrad, I studied abroad in South America. Worked on community health in Ecuador. Um, then I got out. I worked in an ICU for a few years, and I think it was my 2-year mark is when I was allowed to apply for my nursing license in the UAE. So as soon as I'd worked for 2 years, I picked up and moved to Abu Dhabi and worked for the Cleveland Clinic. They were starting up a a new hospital in the UAE.
Mm.
And the initial kind of premise of the hospital was to bring Western style medicine, American style medicine to the Gulf, because many of the residents of the Gulf would actually fly to the US or to the UK to receive health care.
Now
They do have great health.
you're not talking about the Gulf of America.
Oh no, not the Gulf of America. The Persian Gulf, Arabian Gulf, whichever side of the water you're on.
Right, not the Gulf of Mexico, not the Gulf of America,
Correct.
the
Sorry.
other Gulf. No
Yeah,
sweat.
the Arabian Gulf.
And
So a
just
lot of
for clarification, you're born and raised in South Carolina, small town.
yes, absolutely. The school I attended up until my senior year. My senior year, it was finally closed. Um, we would average anywhere from between 12 and 15 kids per class, and it was a public school.
Wow.
Um, it was a small mill school, and like all mill towns in the early 90s, things started shutting down. So the school finally closed in 2006, I believe.
Oh, terrible.
So yeah, very very small town.
Yeah,
I always make a joke like the road I grew up on. I think everybody but maybe 3 or 4 people from my entire family all lived on that same road.
wow.
Um,
That's crazy. So just for comparison, I live in New York City, Queens, and Queens is one of the most populous counties in the nation. It's certainly the most diverse. It's a huge melting pot. I went to Catholic high school. My kids went to Catholic high school. There's probably 1,500 students in my kids' high school, and then they went to Archbishop Malloy. There's another high school, Catholic high school, St. Francis Prep. I'm pretty sure the enrollment is around 3,000. So when you say not even a couple of dozen, it's a mind blower.
yeah, it was K through 12, and I think there were roughly 300 kids K through 12 that attended the school.
Wow.
Um,
So,
like I said, it was a public school. It was very weird. It was shaped like a U. One arm was high school, one arm was elementary school, and then the pieces in between were the cafeteria, the gym,
uh-huh. And now it's
and things like
gone. So what are the kids doing? Is there something that popped up in its place?
no. They just started consolidating all the schools and busing kids to the next closest schools.
Wow. Unbelievable. I guess that's, just part of where we're at in society, but it's a shame. We need our educational institutions. So when it comes to that 4-year degree, that's interesting to me because I think a lot of kids, myself included, when I was back in school, I didn't know what the hell I wanted to do with my life. It's
Oh,
a little
absolutely.
ass backwards, right? You're supposed to figure out and pick a major before you really have had an opportunity to experience life or witness anybody operating in the profession of your chosen career. And so with you, though, what I like about it is you made those 4 years count, and regardless of whether or not you were going to actively pursue a career in nursing, you had a degree that was worth something. So what did you graduate with? Did you graduate as a registered nurse, as an RN?
Yeah, so the way nursing education works is there's a few different degrees. You can become an LPN, which LPNs, some states call them LVNs, a licensed vocational nurse or a licensed professional nurse. It's a degree that's kind of through very similar to like a trade school degree. You go Monday through Friday, 8 hours, and then the kind of the length of the program, due to everything being compact, is a little shorter. And LPNs, LVNs can do most things that are RN registered nurse can. There's just a few things here and there that they're not allowed to do, based off of education. They still take the NCLEX. They still have to take boards and remain licensed professionals. Then you have an ADN degree, which is the associate's degree in nursing. That's usually a 2-year program at a community college, tech school, and then you have the BSN degree, which is the bachelor's in nursing. Since I was already at a 4-year university, that's what was offered. That's the degree I ended up with. Um, for most people that are pursuing nursing, a bachelor's degree usually looks like any other 4-year college degree. You do 2 years of just generic education: English, science, math, foreign language, arts and humanities, and then your final 2 years are very degree heavy.
Mm. And
So
then
after 2 years, you apply to nursing school and have to be accepted to it.
got it. So after 2 years of study at the undergrad level, you then have to apply. Is that what you're saying?
Correct.
And
Usually,
yeah.
I think it was like the ending of your fall semester, sophomore year, you had to start the applications, and then you would have your acceptance by the end of spring to know if you were getting in the program for the following fall.
Is it different state to state, or is that kind of the way it is across the country?
Generically, that's kind of the model for most states.
Okay, cool.
Post graduation licensure is a little, I think that's where it gets a little different. Some state boards require different things than other state boards.
And so you mentioned that you also had the opportunity to do some work abroad while you were a student. You did some traveling. Where did you go?
So for in place of my community health class, I went to Ecuador with a handful of other students, and we did our community health, public health class while in Ecuador. So for the most of the trip, we stayed in Quito, which is the capital, rounded in things like free clinics, soup kitchens, just providing very general health information to people. Then for the second part, we traveled a lot. We Quito's in the very top of the mountains,
Mhm.
so we kind of traveled down the mountains towards the coast. And once you get out of the city, it becomes very rural, very isolated.
Mm.
And again, we just went around, basic health information, education.
How
I
many,
think some of the
how
professors,
many
sorry.
people? How many people were in your group? And also, habla español? How'd you communicate? How'd you get around?
Um, well, in college, I was a lot better at it than I am now because
You lose it if you don't.
you don't use it, you lose it, and that is a prime language is a prime example of that.
Yep.
Um, Took 4 semesters of Spanish through high school and in college. Before our community health class, we were offered a Spanish for healthcare professionals.
Yep.
So I couldn't have a full on conversation, but I can was able to get through a nursing exam, do very basic education,
Okay.
understand what someone was trying to communicate with me from a health perspective.
And so what was that experience like? You grew up in a small town in South Carolina. I don't know if you've done extensive traveling up to that point, but now you're in Ecuador, you're in another country in very remote parts of the country. What was that experience like for you?
Um, is very eye opening. Farms are farms are farms are farms. So I grew up in a lot of farmland, and there were lots of farms there. Um, but much of it was manual, labor, by hand, plowing by hand, or still using horses.
Mm,
The most culturally significant thing I think that stood out to me was just how thankful people were
yeah.
that we were there trying to help them. It was women would bring massive baskets of fresh baked goods or fruit, to us while we were working.
Mm,
Again, everybody as they were leaving were just thank you, thank you, thank you, thank you, thank you. Whereas
a lot of gratitude.
in America,
Yeah.
it's not that way.
Yeah. 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 That's interesting. And so the type of work that you were doing there, though, you there for emergency treatment, any acute treatment, or it was more the basics?
Yes, very heavy emphasis on education, just very basic education that many of us take for granted of washing your hands, making sure your food's clean,
Yeah.
just basic hygiene. You know, I'm trying to our nursing instructors that went with us provided a little bit more thorough
Hmm.
Education, most of them were nurse practitioners, and one of them was actually a medical missionary before she taught
Got it.
at the university. But again, it was very basic, simple things.
Okay. And then so you fast forward and you get through the program, and there's an opportunity through the Cleveland Clinic to go and set up shop in Dubai. What is that like?
Yeah, that was, I just,
How'd you get
I
that
can't even
gig?
put into words.
You
It was,
how'd you come across that? Were you headhunted? Were you actively looking? Did you answer an ad? Like, how does that even work?
well, like I tell most kids in college, just because you network with, or you, I guess, network with your professors doesn't make you a suck up or anything, because at the college level, many of your professors are either retired in their profession, or they're teaching part time and still in their profession. So if that's where you want to enter, there's valuable knowledge, not just from the education standpoint, but from a professional standpoint. So one of my instructors was actually the chief nursing officer for um, one of the largest hospitals in Saudi. And again, she was from South Carolina. I think she was there 10 years. She retired. She came back home,
Dude, don't
taught part time.
Zach, don't take this the wrong way, but you must have stuck out like a sore thumb in
Yes.
Saudi Arabia. is is that fair to say?
Oh, absolutely. But it was so, it really is a small world. So when I got there, it was culture shock. Someone's picked me up at the airport. I was tossed in the back of like this black sedan, had no idea what was going on. I've been flying for 24 hours, show up at a hotel room, fall asleep, and wake up. And I wish I could share the picture of what I woke up to, because I think my hotel room was on like the 40th, 50th floor.
Wow.
And I don't even know if there's buildings that tall in the whole state of South Carolina. And it was just
Brett,
an overview of most of the city and the cityscape. Again, it was something that I'd never seen before. I think the week I landed was at the time of the Red Bull Air Race. So at one point in time, I'm logged into, I think, Facebook, and just messaging like my family, "Hey, I got there safe." The the onboarding people will be touching base with us sometime in the next day or so to get, help us get phones, get our housing lined up. And all of a sudden you just see airplanes come flying by the hotel and just doing loops in the sky. And it was shocking. And
yeah, it sounds like it was a trip. It sounds like you woke up and you looked out and it was breathtaking, right? You were just in
yes,
awe.
it was. And it's beautiful. Like, some of the architecture there is just gorgeous. It's very unique.
Yeah.
And when I said it was a small world, when once we got started and everybody came together, there were two other doctors. There were two doctors there, actually from South Carolina. One of them, actually, we were from within an hour of one another, but never had crossed paths.
Huh.
Um, I think two or three pharmacists were from here. They graduated from University of South Carolina, and then a handful of nurses. So it was very interesting. And then the second year I was there, um, an individual that I actually grew up with in my very small town moved there. Her husband was in the Air Force and had retired and become a jet mechanic for can't remember if it was Etihad or Emirates. But it's like, this is wild. I never thought I would see somebody from home that is also now living here.
That is wild.
But
Particularly because you come from such a small community. So to be that far away and have that many connections, what are the odds of that? It's
right.
but I would imagine that folks in the program that did the hiring, they hired people that they were familiar with or who they knew.
Right, and most people, when we initially moved and for the ramp up and startup of the hospital, the vast majority of all the staff were Western trained.
Mm,
Many of the doctors and nurses were from Europe, the US, Canada, Australia, New Zealand, and then and I guess people came as groups because that's where um, they did employment fairs and stuff. I guess I was just kind of the oddball out because someone had, like I said, my nursing teacher was connected there, and she's like, "Hey, would you ever want to move to Abu Dhabi?" And I was like, I've never thought about anything like that. And
No,
she's
I'm
like,
good.
"Oh,
I'm
well,
good. I'm all right.
yeah." And she's like, "Well, I put your name in a bucket, so somebody will be calling you within the next week anyway." I was like, "Okay, well, and when they first called, again, it was just answered my questions. Would you consider it? And I sat and I prayed about it a lot. And I was like, you know what? Why say no to this opportunity? Um,
Good for you.
and it came up. My parents didn't believe me. And I was showing like my dad. I was like,
Well,
see, this is kind of what my housing will be. This is where I'll be. He's like, yeah, you're not going anywhere.
right.
And then I think it was Thanksgiving Day of 2014 was actually when I flew out, and he had to drop me off at the airport. And I was like, see, I told you I was leaving.
Wow, that's crazy. And so overall, how many years were you there?
I was there a little over 2 years. Most of the contracts there are a 2 year kind of tenure, but then they become open ended. So you don't have to reapply for your job or anything. It's just sign up for 2 years to make sure that, us flying you out here, getting your nursing
Sure.
license transferred over, and all that stuff is
Yeah,
worthwhile.
they want to recoup their
Um,
investment. So, what was the mission of, like the question on the tip of my tongue is, what is the Cleveland Clinic doing in Dubai?
well,
What was their
the
mission?
Cleveland Clinic is, you know, always within the top 3 to 5 hospitals in the world.
Okay.
It's an incredibly innovative health system, and especially when it comes to cardiac care. Their cardiology program is it's just mind blowing. A lot of patents are held by physicians in the Cleveland Clinic. A lot of firsts happened at the Cleveland Clinic, and again, many people from like Saudi, UAE, Bahrain, Qatar would all seek healthcare in the US. And a lot of times they would go to places like Johns Hopkins, Mayo Clinic, Cleveland Clinic, the
Mhm.
big names of healthcare.
Yeah,
And then I think one day the UAE government was just, hey, would you be open to partnering to just build a hospital here so everybody can just travel here versus
sure.
you know overseas? And that's how it came about.
And what was the
um,
what would you say the experience is for a patient there versus here? I would imagine the health system is completely different. Is it government sponsored? Is are patients paying out of pocket? Because you're talking about one of the most affluent communities on the face of the planet, if not the most affluent. In terms of per capita income, it's off the Saudis have money. So, how does that healthcare experience look like to a patient versus what the experience is here in the U.S.?
in the United Arab Emirates, which is kind of where Abu Dhabi and Dubai are located, is kind of it's an interesting mix of insurances. And there, if you're a local, if you're an Emirati, like I'm trying to think of the right word, like you're genetically, culturally an Emirati. Um, you're provided free health care by the government. If you're an expat, so anybody else that's moving in, your employer sponsors your health care, which I think is pretty great. Like I had to pay nothing. You don't pay premiums out of your check every month. You don't. That's part of you being there is your employer provides your health care.
Mm,
So hospitals there were kind of based off of tiered. So if you had this type of insurance, you went to this hospital. If you had this type of insurance, you went to this hospital. Um, and working for Cleveland Clinic, we were allowed to get health care there. Plus, most of the local Emiratis would come there as well because it was a little bit more of that higher tier, prestigious type of care, and it was the care provided was very similar to what we get here based off of an operational standpoint, but many of the rules we began to follow were based off of European more labor laws. Like we would get a lot of vacation time. The ratios for nurses to patients to doctors to patients were a little bit more um, strict than what they are in most of the US. In the US, there are certain states that have enacted nursing ratios. So, like in California, I believe if you're in the ICU nurse can have no more than two patients.
Mm-hmm.
In South Carolina, those rules do not exist. I've worked in the ICU and I've had three very unstable patients before, and it's just that's where we are.
Yeah.
Um,
Yeah. No, it's interesting.
so we enacted that, and usually,
I appreciate you sharing that insight because the name of the show is Broken Healthcare, and I think part of the issue is the burden and the tax on the system, just in terms of volume, how many patients you're seeing. To your point, and it's interesting to hear that a state like California has a rule where if you're an ICU nurse, you can't have any more than two patients, but that's the exception, not the rule. And
correct.
and so that being the case, what I'm hearing is, at least in that regard, the standard of care in terms of the patient's experience is better under the European law than it is here in the US, because they have those guidelines, whereas they just don't exist here.
Absolutely. And, when you hear those arguments of, the socialized medicine versus American medicine, of people have to wait forever and ever always to get care that they potentially need versus you or I can walk into an ER and be seen hopefully within a few hours. If it's an emergency, we get surgery right then and there. Um, but it goes to the point of, if we invested in healthcare more, if we drove that more community based approach, which as an ICU nurse, I was involved in more of the acute care side of the hospital. But at Cleveland Clinic in Abu Dhabi, they had built like this huge industrial kitchen in the basement or sub level. I don't want to call it a basement because it was this big, gorgeous
Yeah.
glass room overlooking a river or something. But they built this kitchen where dietitians would actually teach classes to people. Oh, you have heart disease, diabetes, things like that. Here's how to prepare healthy meals based off of your health.
Mm-hmm.
And again, as an ICU nurse, I see the after effects, the end effects of all those things. And where I am now working in addiction, during in ICU, I would see, I was a young nurse, like between 22 and 25, I was in the ICU, and I would see so many people younger than me at the time, you know, overdosing, dying, things like that. And it's, how do we get ahead of that from the hospital? And then if you want to look at it from an economic perspective, you pay, I don't know, a nurse or a provider, and with insurance, say a 30-minute doctor's visit, a physician may be reimbursed. I mean, I don't know, but probably less than or equal to $100, maybe.
Mm-hmm.
Versus if someone ends up in the hospital, even an ER visit, if you're in the ER for 30 minutes, if you've ever been in the ER, you're getting a bill for $200, $300, $400, $500. And your insurance, the person pays it, your insurance has to pay some. So it's cheaper in the long run to preload healthcare in the community, provide treatment in the community, than it is to just wait once someone ends up in the ICU. I mean, ICU rooms are $12,000 to $20,000 a night.
Sure. Yeah.
So if
No,
you think of,
you make an excellent point, and I think it's one that politics aside, we're a $5 trillion economy. Healthcare is, right. It's a fifth of 20 cents of every dollar we spend goes to the healthcare ecosystem. Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket cost for healthcare. Visit benefixa.com today. So if you look at the incoming administration and RFK Jr. and Marty McCary, regardless of politics, put that aside. Put your preconceived notion of what their past and their history and their opinions are, and get off social media and open your eyes and open your ears. Change is needed in the system, and these two figures definitely are bringing about change. And if you follow them as I have, I'm encouraged because what is the saying? An ounce of prevention is worth a pound of medicine, something like that, right? So the idea is, where it's not healthcare in the US anymore, it's sick care. And at that point,
Yep.
it's a little too late, right? So we need to get on the path of what should our behavior be like so that we can avoid the train running off the tracks and needing to be in the ICU and medical intervention. Let's get ahead of that. And how do we go about doing that? Now, when it comes to addiction, it's maybe easier said than done for some, right? Because at the end of the day, I could tell you personally, I'm addicted to food and I'm addicted to alcohol. And I go kind of up and down like this. And I'm not here to preach and say, you got to do this or you got to do that. No, this is America. This is we're a freedom place, right? You have the right to choose. But I had the good fortune to interview some incredible folks on the show. One of them, Dr. Jack Wolfson, and what he said was, and he's like America's number one natural heart cardiologist. And what he said is, look, if you want to put poison into your body, go right ahead, but you're not going to tell me that I'm going to do it, and my family is not going to do it. And so really it's a mental mindset. But when especially when you're young and you're in your teens and your 20s, you got the big S on your chest, right? You're Superman and nothing can hurt you. And so I think that society is predisposed to eat to excess and drink to excess. And, just using myself as an example, I was at a place where, just a month ago, I was 20 pounds heavier than I am. And it was just eating all the wrong things, drinking to excess. And finally, I got to a point where I was just like, what the fuck are you doing? Like and for me, I'll tell you, the shift was, and again, this is just my personal story. It was a wake up call that I had with myself. And I said, you know what, Ray? You don't like the way you look. You don't like the way you feel. You're not getting the sleep that you need. You got to do the work. And that was it. It was just that one little, you got to do the work. That was my wake up call. And I'm not getting on a soapbox saying that I'm going to, my hope is to continue this journey and get to a place of optimal weight and health and fitness. I'm probably 40 to 50 pounds away from optimal for me. And I pray that I get there, but it's a struggle because all of the bad stuff tastes so good. and the brain leads the body. And so your brain says, have a glass of tequila or have that pizza with pepperoni and sausage, and have another one and have another one, have another one. And it's very hard to put to defend against that, because literally your brain is firing off dopamine. It's like fireworks going off in your brain that are
Right.
saying, give me more of this. And it's one of the hardest things to do, is to change your behavior. And I'd love to know what your thoughts are. Why is it that, and okay, so I haven't touched that stuff. I've made kind of a decision that I'm going to eat whole foods, not processed. I'm not on any particular diet. I'm considering this a new lifestyle path. But what is the difference between someone like me who has the ability to even go 3 or 4 weeks and, with a plan of going long term versus do you believe that there are certain people that just can't? Or is it mental or is it something more than that?
It's all of the above, really. Over the past few years, social determinants of health have been, a hot word, a keyword for a lot of things. And if you really delve into it, it makes sense of why it's so important to address someone's socioeconomical needs for their health. Like you said, you've made the transfer from processed foods to whole foods. However, when you're shopping, is that not just slightly more expensive? Um, so that's a very high level of it. And then with addiction, you know, many times addiction runs in families. Is it nature versus nurture? It's hard to really give a definitive answer if that's what you grew up in. Did you grow up in it because that's genetics, or did you also fall into that because that's all you knew? Um, and many people do have the ability to turn it off. You're a successful guy, you're an intelligent guy, you can be cognizant of these actions and take other actions, whereas some people may not have that education or ability. You can take your family and go get dollar cheeseburgers for dinner at McDonald's one night, and from one thought your belly's full, your kids are bellies are full, everybody's happy. Are they healthy? No, not necessarily. Or you can get off, people in different socioeconomical states may be working 2 or 3 jobs, so they may not have the ability to get off, go home, prepare and cook a full nutritious meal, or there may be in a food desert. There's no good grocery store or market close by to them to get those things for an everyday meal. And like you said, with alcohol, some people it's a pleasure thing, some people it's a coping thing. Um, some people may need a drink to shut their mind off at night and to go to sleep.
Yeah, I do.
Some
Listen,
people,
honestly, Zach, I like the taste of tequila. It was more for me a social mechanism. And look, I'm fortunate in that I'm not taking mother's little helper. I don't take any happy pills, um,
mhm,
or anything like that. So my go-to was wind down with a couple of glasses of tequila, which is way too much. I mean, going through like a bottle or two of tequila a week should be a wake up call. But it
absolutely.
wasn't like I was, getting
And,
smashed, slurring my words.
and societally,
It was
you
just
know,
it just kind of quieted my mind and made me at ease. But I think it was when, I did blood work and I spoke to, a medical, who's a nurse practitioner, that it just kind of started coming together and I was like, look man, you gotta cut that
right.
stuff out. But what
And societally,
go,
with you
yeah.
doing that, but that was you're at home, you're winding down, even though you knew that that was unhealthy and not unhealthy kind of physically and mentally, you could stop. But because societally that's okay, the term functional alcoholic didn't come around because somebody just come up with it. It's, hey, what Ray does in Ray's house is his business,
Yep.
but he works, he um, provides for his family. He's a functional member of society, so nothing's wrong with that.
Hmm. Yeah, and that's a problem because there is something wrong with that for me, right? So
Right.
I was functioning, but was I functioning optimally? Hell no. I was a world away from optimal. But my curiosity though is, what is the difference between someone like me that can kind of flip a switch. And then you hear about folks that go through DTs and shakes, and I didn't have any of that. Like I didn't, maybe there was a day where I felt a little headachy or something like that. Very, very mild. But there were no heavy, serious withdrawals or anything like that. But there are folks, and I don't know if there's a gauge or a meter for the difference between my alcohol intake and maybe someone that's drinking a bottle a day. Um,
Mhm.
or if it's a combo of that and genetics. What is, just like, what is a comparison between what I experienced and what someone who's really a hardcore alcoholic might go through?
Yeah. Well, I mean, with you having headaches and things, that is some withdrawal symptoms.
Yep.
Um, a lot of times, to bring it into perspective with people, I just use coffee. Most Americans drink coffee.
Mhm.
Most people have to have a cup of coffee to get up in the day, and your body is addicted to caffeine.
Mm.
If you drink soda, coffee, tea, caffeine is an incredibly addictive substance.
Mm.
If you meet that person that they're a 2-3 cup of coffee a day drinker, and they don't have that second cup, or they didn't even have their first cup, they're usually very irritable. Um, they may be complaining, "Hey, I have a headache. I can't focus." Um, just snapping at everyone. That's classic withdrawal symptoms.
Mm.
So what you went through was, withdrawal symptoms on a very mild scale, but yes, there are those people who go through the more life-threatening withdrawals.
Is that
And those people
is that all
usually drink a lot more heavily.
when people say they're hangry?
Yes.
Someone hasn't eaten for a while, and then they're irritable. Same thing, like they're
I mean, it's your body withdrawing, your body saying, "Hey, I need my pleasure centers filled, and I'm not getting that."
right. So tell us a little bit, Zach, about, to kind of take us through your program and how it works. Is this something that is public facing? Do folks
Absolutely.
can anyone kind of benefit from your service? Is it virtual? Is it local? And what's kind of, take us through like a typical process for I don't know if you're finding the patient, if they're finding you, and just kind of walk us through that.
Just starting out, like you asked, is it public or private? And we were talking about societal norms earlier. Addiction, and the word functional alcoholic, I use that a lot because, again, that's acceptable in our society. With opiate use disorder, pain pills, heroin, fentanyl, things like that, the statistics from the government are most individuals diagnosed are suffering from an opiate use disorder are blue collar working class people, usually men between 35 and 55. And if you dissect that sentence, blue collar working class means they are keeping a job, they're functional, but there's no term, he's functional, he just eats pain pills, or all these
Right.
derogatory kind of terms. But it's someone who you know, could have gotten hurt at work. 10 years ago, 20 years ago now, when oxycodone come on the market, someone would get hurt at their job. They're a blue collar worker. They're working hard labor around here in South Carolina. The massive BMW factory is here. Um, a lot of people work for that, and they may get hurt on the job, hurt their shoulder, hurt their back. Went to the doctor. Oh, hey, well, here's this new pill that just came out. Oh, well, I feel amazing. I don't have to take a sick day.
Right.
Now, 10 years down the road, we know that, yes, you do feel amazing, but if you go without, your body does not know how to go without anymore.
Right.
Um, so our biggest push is to treat addiction as any other disease. Something that brings it into brings it into perspective for a lot of people is, I just compare it to type 2 diabetes. Type 2 diabetes is usually a lifestyle disease, sedentary lifestyle, poor diet, and your body just doesn't know how to process it much anymore. However, once you get to a certain point with diabetes, you may have to start taking medication, just by mouth medication, or it may get to the point where you're needing to take, insulin injections. With addiction, it's the same thing. It could have been started out as a lifestyle disease, a coping mechanism, self-medicating from some other health condition. But we don't treat it like a disease. The old kind of methadone clinic model is daily dosing. They come in once a day. Usually the hours are between like 5 and noon, 5 a.m. to noon. You stand in line, you get your dose for the day, and it's just rinse, wash, repeat. Our model is you make an appointment like a regular doctor's office. You come in, we, the first appointment, the doctor does a full assessment like your family doctor does, but it's more gauged to what substance were you using? When did you start using it, and what does your use look like now? Is it something to help you sleep at night, to shut off your brain? Is it I can't function during the day without doing something multiple times through a day? And then those care plans are geared towards that person of let's focus on what's leading up to that. And then we prescribe a medication. The common name for it is called Suboxone. The generic kind of name is buprenorphine. And what it is it's a medicine that is a partial opioid is kind of how it's classified. So when you take it, it fills the receptors in your brain up enough that is supposed to control those cravings or those needs or those like pleasure center drives of I need to have this or I'm not going to be a happy person
Mm-hmm.
or I'm going to be grumpy. But it cannot fill your receptors up enough that you can overdose.
Mm.
If someone takes their entire prescription of Suboxone or buprenorphine at one time, it won't do anything to them. It plateaus
Mm.
in your body. So it's a very safe alternative that can control those cravings and allow someone to focus on, the surrounding things that led up to, their disease.
Mm.
Just like with diabetes, you implement lifestyle changes.
Yeah.
You may have to take medication to keep you safe and healthy, but then it's, hey, let's try this diet, let's try this exercise. And there's many people that with diabetes, after implementing those lifestyle changes, they no longer have to take medication.
Mm-hmm.
So that's kind of how we look at addiction. And Medisic, we take all insurances because, like I said at the beginning, it's blue collar working class people, so more than likely they have insurance. We are in network with Medicare, Medicaid, VA benefits, and we kind of did that full spectrum because people with Medicaid where we're from, it's very hard for them to get any type of care, period.
Yeah.
Most providers don't want to take it. And if it is a provider that takes it, they're overworked, overwhelmed, understaffed.
Yeah. Yeah.
So people just either we go to events, I try to be out in the community and, provide this type of education. I've met with police departments. Many people in addiction are also have some sort of run in with the justice system in part of their life. And, it's how can we help them? And then we have contracts with the Federal Bureau of Prisons as well that if someone, is incarcerated due to drug related crimes or just admit that they have an addiction while they're incarcerated, the Federal Bureau of Prisons will actually start providing care for them. Extensive counseling and therapy, medication management, like what we do. And we provide that medication management at a lot of the residential reentry, kind of the halfway houses in South Carolina.
Mm.
And recidivism rate is another kind of hot topic with a lot of things, and it's absurdly high. I can't remember the percentages, but I think it's above 70%. Most people that are justice impacted end up incarcerated again.
Mm-hmm.
But what we see when we provide that care for people and you treat what's going on and their underlying issues, they go back to living happy, healthy, productive lives.
Mm.
Um,
What is
So it's
what is a typical? Is there such a thing as a typical treatment protocol in terms of the length or the duration of treatment?
historically there used to be you can start someone on a medication assisted therapy program, and it would need to, by 6 months to a year, you should start tapering them off. Um, However, research shows now that if someone's on medication assisted treatment and they live happy, healthy, productive lives, there's no harm of them continuing that medication. Like, and you can think of as like any other behavioral health, mental health type of medication is you don't start someone on, antidepressants or anti-anxiety medicine
Hmm.
and tell them, in 6 months to a year, they need to figure out how they don't need their medicine anymore.
Mm.
Um,
What about
so again, it,
do you have any experience with some of the kind of vilified treatments? If you look at plant-based medicine like psilocybin, I know that I've listened to Joe Rogan's podcast where he had Brigham Bueller on from Ways to Well, and he talked about that. And there was also, I think, the former governor of Texas was on saying that he wants legislation to allow psilocybin, particularly for our veterans that are suffering PTSD. And I'm sure there's a pretty strong correlation between folks that are suffering PTSD with addiction. So, can you speak to that at all in your experience? Is that something that should be allowed, or is that just out of your purview?
I'm honestly, I don't know very much of. I know that there's a lot of research surrounding it now, a lot of big push surrounding psilocybin and microdosing now.
Yeah.
Um, you know, there's microdosing of ketamine now to try to help with a lot of things.
Mm.
My like not in the opinion of the company or of anything, but my personal opinion, the opinion of Zach,
Yeah.
is there's a lot of things that I think we need to dial back legislation on.
Mm.
Um, Marijuana, there's half of the states it's legal, half of the states it's not. Some states it's for medical use, some states it's for recreational use. However, if alcohol is legal, why are other things not legal? And I think if we begin to make certain things more legal and accessible,
Yeah.
I think it would help a lot more people than it would harm.
Yeah. I'm glad you shared that because I happen to agree. The answer is money, Zach. What's the question?
That's the answer for everything.
Ex-
Um,
exactly.
but
Yep.
it's just we hear of people at our clinic, if someone comes in and they're positive for, say, THC, um, a lot of treatment programs may take that as not a good test,
Hmm.
not a good result of a screening.
Hmm.
However, it's again, there's so many things in this world that because of politics and, like you said, money, that are illegal. But does that cause harm to anyone more than it can cause good? And there's a lot of older folks that I've talked to and out in the community, and they ask, opinions of THC use, and it's like, well, I just use it to go to sleep at night. Hey, I was in the Vietnam War, and if I don't have someone to help me go to sleep have something to help me go to sleep at night, I can't sleep. I
Hmm.
see things, I hear things, I have flashbacks.
Yeah.
And again, is there much difference between them, having an edible versus drinking 6 beers, having 2 glasses of liquor, having, 3 glasses of wine?
Yeah.
Not really.
Right. No, I agree. I think ultimately we have to be the best brand steward of our own body, and this is America. This is the land of the free. So if you want to drink yourself or take opioids to death, it's your right. Ultimately, like really truly, it's your right. But is that really what you want? Is that really what you want, or is there something kind of pulling at you, tugging at you that's prompting this behavior? And is it going to get you where you want to go? And I think ultimately that's where an organization like Medisick comes in. You guys are focused on working and counseling folks so that they understand that they have options. And if they do want help, and I think that's a big piece of it, right, Zach? They have to truly want help.
Right.
They have to be on board. They have to be looking to make a change. And I think sadly, a lot of people may be in that boat, but don't even know it. You know, they're kind of too far. They're too far gone, too far off the beaten path to even know how to begin to look for help or that they even need it. And so, you know, that process, I'm sure, is where your team comes in and very diligently and methodically has a process to take someone through and ultimately hit milestones and checkpoints along the way to get them where they need to go.
Right. The education is kind of the basis for anything.
Yeah.
Um, once someone is fully, like you said, everything, things should be legal. If somebody wants to do X or Y, that's their choice. However, I do agree with that, but we need to make sure that people are fully educated on what they're choosing. Some people, like going back to the Oxy, people thought it was safe.
Mm.
It's non-addictive. But now what we do know, and once that education is provided, a lot of people choose, hey, I'll forego that after my procedure. I'll try with Tylenol, ibuprofen, things like that. If it gets worse or I can't control my comfort, I'll let you know. And I think just providing education on anything and everything is how to help someone.
Mm.
In our program, it's providing people with a lot of community resources and the education of how to get those resources.
Yeah.
Hey, there's a mental health crisis line if you ever need anything. It's 988 versus 911. People can call that number. There's free resources all over the internet if somebody just knows how to look. There's probably tons of free resources in their community if they just know how to look. And once some of those social determinants are addressed, or you may get someone's basic needs taken care of, or in a better position than they were, recovery and healing is a lot easier.
Yeah, for sure. So, Zach, you've shared a lot today. Really appreciate your insight. If folks want to find you, what's the best way to do that?
Our website is www.medisick.com. You can go there. It has all the phone numbers of every office, the intake lines for the different, areas of South Carolina. We only operate really in South Carolina right now. One day, I hope that we're nationwide. But just go to the website, and that's where most of our information is. And we do medication assisted therapy with opiate use disorder, with alcohol use disorder. And we also have psychiatry staff, on mental health staff, with psychiatric nurse practitioners on staff too, to help if there's other needs surrounding kind of addiction, or if you just need mental health care, we have that as well.
Wonderful. Well, hey, Zach, thank you again for being here. Really appreciate it, folks. It's www. I don't even know if you need that anymore. Medisick.com. That's MEDESIC. Is that right? Or is there a K in there?
MEDASIC.
MEDASIC. I'm glad I checked. Yeah. MEDASIC.com. And you could learn all about Zach and his organization. But Zach, thanks again for being here. Really appreciate it. Folks, we'll catch you on the next one. Until then, peace and love. Peace and love. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.